So now we get to hear from Jeremy Simmons and his, I love this already, the harm reduction vending machine.
Hi, I'm Jeremy Simmons. I'm the clinic coordinator with HOPE, which stands for Health Outreach Prevention Education Incorporated. Two of the main things we focus on is HIV testing and Hep C testing for free. My project that I want to talk a little bit about today is a vending machine that has harm reduction supplies. And that's going to be a lot of harm reduction supplies focused on people who use injection drugs and reducing their chances of accidentally overdosing or getting hepatitis C. Unfortunately, at my clinic, we have to give way too many positive results, particularly for Hep C. And in Oklahoma in general, we have a much higher rate of Hep C and a much higher rate of accidental overdose death than most other states. From a personal perspective, I've seen that firsthand as well with a very good friend of mine who accidentally overdosed. And that's a personal experience that way too many Oklahomans have had to go through. So, what are some of the ways we can help with that, right? One of the reasons people won't access services is because they feel awkward about interacting with people. And so a vending machine allows a certain level of anonymity for people who have shame around what they're doing or are afraid of being caught, okay? Also, it's a program that while it's new to us and it's new to Oklahoma, we think, it's a program that has shown some success in other cities. Gilead has graciously agreed to fund the program already, so we have the funding in place. We have some of the plans, which our new employee, Alexa Bottoms, will talk a little bit more about soon. We have, one of the unexpected challenges was we had expected to have this hosted at another site where people could access it in another area more easily. We are probably going to have to start it off at our main clinic. So there have been some adaptations made, but we have the funding for it and we have some of the models. And I'm going to let Alexa talk a little bit more about that.
Hi, my name is Alexa Bottoms. I'm the Harm Reduction Outreach Specialist with HOPE and Oklahoma Harm Reduction Alliance. The Connect vending machine was started as a collaborative project between the two organizations in an effort to provide low barrier access to folks who use drugs to both harm reduction supplies and safer sex materials. Following production, the Connect vending machine will be housed at HOPE's testing clinic located at 3540 East 31st Street in Tulsa. Participants can enroll in the program through a staff member at Okra or HOPE, in person, online, or via referral through our partner agencies. The initial machine will carry 4 types of kits: a safer sex kit, safer snorting kit, a hammer kit, and a bubble kit. In our safer sex kit, participants will find external condoms, internal condoms, lube, hand sanitizer, and masks. In our safer snorting kits, participants will find straws for individual use, sterile plastic razor blades, as well as safer sex supplies. These are our hammer kits, and these are our bubble kits. In addition to these kits, participants can also access sterile syringes as well as disposal bins for the collection of used syringes. Our machine will also include Narcan and fentanyl testing strips. Research shows access to safe supplies like these greatly reduce a person's likelihood to contract or transmit illness or die as a result of drug use. Once enrolled in the program, participants are given a unique ID number which allows them to access supplies in the machine. Participants are also linked to other services provided by Hope and Okra as well as their partner.
Alexa and I want to give a huge thank you first and foremost to Gilead for agreeing to fund this project. For the director at Hope, Taryn Norman, and the co-directors at Okra, Haley Ferguson and Andrea Haddix, for helping out with the brainstorming, implementation, and grant writing on this. And I also want to really thank the team at Leadership Tulsa and my cluster for giving me so much great feedback and a space to talk about some really awkward topics and make this a much more successful program.
Again, another why doesn't this exist already? And that's one of the things I love about doing the showcase is I'm like, oh yeah, why isn't that a thing?
Yeah.
So let's bring on Jeremy and talk to him more about this awesome idea. Hello.
Hello, Jeremy. Hello. So my first question is, for people that may feel distant from this problem, they feel like that this particular issue doesn't affect them, Why should it be important to them? Why should it matter to them?
That's a great question. So, unfortunately, every year for over a decade, Oklahoma has been in the top 10 amongst new Hep C infections as well as accidental overdose rates. So a lot of times, I think particularly people in the Midwest tend to feel like drug use might be a big city problem, and they tend to distance themselves from it. But actually, a lot of the Southern and Appalachian states have much more of a problem with Hep C and overdose than the other places in the U.S. So, and obviously that's directly felt by the people that die in the most intense way. And from a big picture perspective, it's doing ambulance pickup, ER visits, ICU visits for people who have overdose reactions, and doing the long-term care and treatment for Hep C is something that the state spends an enormous amount of money on. So it's just doing prevention just saves people from dying in the most extreme situation, but in the midterm, it keeps us from spending so much money on treating the problem at the end.
And so, I mean, I guess why a vending machine over, packages or places where people can go to pick it up? Like, why the vending machine as the vessel for this?
That is also a great question. So we partner a lot with SHOTS and the Oklahoma Harm Reduction Alliance, and they have direct distribution and mail out. So there is already some of that being done in Tulsa. But there are still some people that won't access that because they don't want to engage another person. You know, there's so much stigma around this, and some people are so afraid of being arrested or losing a job or losing their kids or whatever if people find out they're using drugs, that they can get so fearful of that they won't access safe sex supplies, or more importantly, injection drug use related harm reduction supplies. So we're trying this. We researched it quite a bit, and it's been shown, like I said in the video, to be successful in some of the larger cities at catching some of those people that just won't access us otherwise.
And I know you mentioned that you are going to start out with it at one facility. Do you have plans to expand to other locations, other partner organizations?
I would love to do that. And so we really wanted to focus on injection drug use related harm reduction on this round, in part because there's a new law. So it used to be illegal to hand out pipes or needles in Oklahoma, and there's a law that went into effect December 1st, changing that. So we knew that there was a law coming that allowed us to be a little more free with promoting this. The one catch, and one of the reasons why that Alexa didn't talk so much about a couple of the kids, is because it's not illegal anymore, but you have to register as an approved site with the state health department, and the state health department doesn't have a format for that. So in typical sort of state of Oklahoma fashion, they actually made an improvement, but then the catch was you have to register, and there is no registration process. So we have the funding, we've ordered the machine, we're hopeful it'll be here by February at the latest, and hopefully by then we can register to legally distribute needles, or do it anyway and then cross that bridge when we come to it.
Yeah.
So, but she didn't. That's why she kind of was a little sparse on describing some of the kids, because we were like, well, maybe we shouldn't say in a video that we're sending out to the world that this machine will have needles and pipes in it, because technically it's still illegal. So we're in a little bit of a gray zone, but we are, the guys at Majestic are really interested in us having a machine there that's a little more focused on young gay men and young heterosexuals that frequent that club. And so I would like to do a second machine that has more of a sort of a young person's safer sex harm reduction angle. And we've also talked about distributing some rapid HIV tests that people can do. Am I there?
You're still there. Yeah.
Okay, but that has some pros and cons too. So there is another place that already says, yes, we want one of these. So, but we're going to work with the first one and have it in the clinic, which again, wasn't my main goal, but when we talked with Track B, the provider, and some of the other cities that have done these programs, they said that actually in the first several months or first year or two, they had to do it at their main site just so that they could get community partners and funders and health department and everybody familiar and comfortable with it. And then they were able to place it in another location.
Well, excellent. Ed's really taking care of a lot of my questions. He's put on the screen like how to find out more about your about this project that you're doing. But for the people watching, like, what is the best way and what's the best thing they could do to help you with this?
So the best thing they can do, honestly, is the main thing we need before we get more machines going is funding. So going to hopetesting.org and donating. If you're interested in helping out in the clinic in a more hands-on way, I can actually train people to become testers and counselors. So we have other opportunities for people who can't donate funding. So we can actually train you how to do some of the limited sexual health services that we do here. So people who want a more hands-on experience, just let me know and I can train them to be a tester.
Well, thank you again, Jeremy, for this really important project, and we wish you all the success in the world with it.
Thank you so much.
Oh, we do have one question that popped up, and that is, can a business reach out to you to place a vending machine at their location if they want to?
Yes. So we are going to get the first machine in, do some trial and error stuff with that in-house. And then, like I said, we are probably going to work with Majestic as our second site, hopefully. So other sites, I'm happy to do it. The machine costs about $9,000. So there's a little bit of an initial investment. So that's the biggest barrier. So dropping off the supplies, maintaining the machine is not that labor intensive or costly, but so that's the one thing we really have to be judicious with each site that we pick, because it's going to be close to $10K per spot.
Mm-hmm. Well, thank you again, Jeremy.
Yes,
Thanks for having me.